Hi, I'm Natasha, and I'm going to be explaining how to do a gastric intubation. My dog is currently sedated. I'm not going to be performing the skill, but I'm going to explain how to do it. There are complications that could arise from doing a gastric intubation, including gastric irritation, gastric perforation, or esophageal trauma. So my veterinarian would prefer for me to perform this skill unless it was necessary, but I'm going to explain how it should be done. So our dog would be in sternal recumbency or sitting up. Then you would have your tube and you would measure from the point of the last rib. So we find our last rib, and then we'd measure up to the tip of the nose. And then we would mark the tube either with a permanent marker or a piece of tape. I have already put our piece of tape right there. Then you would lubricate the end of the tube. Grab a speculum, or in this case it is a new rolled tape, and that helps hold the mouth open. And then while it is open, you would insert the tube through the rolled tape, through the speculum, and continue to go down, making sure that you are in the esophagus and not the trachea. And you continue to go down until you've reached your marked point. A couple things that you can do to make sure that you are in place would be to palpate the neck to make sure that you're feeling two tubes in a sense, so you're not only feeling one, indicating that the tube is in the trachea. You can blow at the end and have an assistant listen to the stomach, just to make sure you're hearing like gurgling sounds. You could just smell the end of it to see if you can smell any stomach contents, gastric stomach contents. And you can also get a small amount of sterile saline and flush down the tube, and then observe for any coughing or problems. Once the tube is in place, then you would continue to perform whatever procedure that you needed to while you had done the gastric intubation. But that is explaining gastric intubation on a dog.